Hello everyone, I am Kanajun Tipon and today I am going to illustrate the anatomical terminologies and where to locate it on our body. First is the regional terms used to designate specific body areas. Where to find regional terms in anterior or ventral position. First is the frontal or the forehead, orbital or the eyes, nasal or the nose, oral or the mouth, buccal or the cheek, the mental or the chin, cervical or the neck region, the acromial or the point of the shoulder, the deltoid or the curve of the shoulder, the brachial or the arm, antecubital or the anterior surface of the elbow, the antebrachial or the forearm, the carpal or the wrist, manus or the hands, the digital or the fingers, the sternal or the breastbone, the pectoral or the chest, the axillary or the armpit, umbilical or the navel, the pelvic or the area overlying the pelvis, inguinal or the groin, pubic or the genital, coxal or the hips, femoral or the thigh, and it is applied in anterior and posterior surface or position. The patellar or the knee, the crural or the leg, fabular, the lateral part of the leg, tarsal or the ankle, the digital or the toes. Next is where to find regional terms in posterior or dorsal position. This is the occipital or the back of the head, the cervical or the neck region, the acromial or the point of the shoulder, deltoid, curve of the shoulder, the brachial or the arm, the olecranial or the posterior surface of the elbow, the antebrachial or the forearm, scapular or the shoulder blade region, vertebral or the area in spinal column, lumbar area between the ribs and the hips, sacral or the area between the hips at the base of the spine, gluteal or the buttocks, femoral or the thigh, popliteal or the posterior surface of the knee, sural or the posterior surface of the leg, tabular, the calcaneal or the heel of the foot, the plantar or the sole of the foot. Next, let's proceed to the orientation and directional terms. First is the superior, or the upper part of a structure of the body. Example, the forehead is superior to the nose, meaning that the forehead is above the nose. Next is the inferior or the lower part of a structure of the body. Example is the navel. Navel is inferior to the breastbone, meaning that the navel is below the breastbone. Next is the anterior, or in front of or at the front of the body. Example, the breastbone is anterior to the spine. Next is the posterior. Example, the heart is posterior to the breastbone, meaning that the heart is behind the breastbone. Next is the medial or midline of the body. Example, the heart is medial to the arm, meaning that the heart is in the inner side of the arm. Next is the lateral. Example, the chest is lateral to the shoulder or the arm, meaning that the arm is in the outside part of the chest. Next is the intermediate or between a more medial. Example, the collarbone is intermediate to the breastbone and the shoulder. Next is the proximal or the close region to the body. Example, the elbow is proximal to the wrist, meaning that the elbow is close to the shoulder than the wrist. Next is the distal, meaning farther from the origin of the body. Example, the knee is distal to the thigh, meaning that the knee is farther to the thigh. Next is the superficial or the body surface. Example, the skin is superficial to the skeleton, meaning that the skin is external to the skeleton. Last is the deep or the away from the surface of the body. Example, the lungs is deep to the rib cage, meaning that the lungs is more external than the rib cage. So let's proceed to the planes of the body. So sagittal plane is a cut along the lengthwise or longitudinal plane of the body, dividing the body into right and left parts. If the cut is down the medial plane and the right and left parts are equal in size, it is called mid-sagittal plane. Next is the frontal plane. If the cut is along the lengthwise plane, that divides the body into anterior and posterior parts, it is also called coronal plane. Next is the transverse plane. Transverse plane is a cut along a horizontal plane, dividing the body into superior and inferior parts. It is also called cross plane. Last is the 4 abdominal pelvic quadrants. 4 abdominal pelvic quadrants. So this part is the right upper quadrant or RUQ. Below it is the right lower quadrant or RLQ. And the left side is, in this part, the left upper quadrant or LUQ, and below it is the left lower quadrant or LLQ. So that's all. Thank you.